So for this next talk, I'll be giving an update on breast density. I have no disclosures, and I would like to acknowledge my colleague, Dr. Amy Lee, for her contribution to some of the contents of the talk. Breast density is a very important topic in breast imaging. Not only is dense breast tissue an independent risk factor for developing breast cancer, but dense breast tissue can mask cancers and result in delayed diagnoses. There's been a grassroots movement to inform women about dense breasts, and as a result, the majority of states have now enacted some form of breast density notification legislation. Very soon, this will affect all of the states in the US. By September 10th, 2024, all mammogram reports that are sent to patients in the US will be required to include breast density. So this is an increasingly important topic for breast imagers. And my message to you in this talk is that an understanding of the definition and implications of dense breast tissue will help allow us as a breast imager better communicate with our patients and clinicians. So for the outline for this talk, we'll start by talking about the origins of breast density legislation, current status of those legislation, definition and categorization of breast density, and finally, clinical significance of dense breast tissue. Let us start with origins of breast density legislation. So what are the origins of breast density legislation and what prompted all this interest in breast density that we are covering in this talk today? Well, in 2003, a woman named Nancy Campello had her annual screening mammogram. She was informed that her mammogram was normal, with no suspicious findings, no evidence of malignancy. However, just 6 weeks later, a palpable lump was detected on her clinical breast exam. She was brought back for diagnostic imaging, including a targeted ultrasound, which showed a 2.5 centimeter mass. She was ultimately diagnosed with stage 3C breast cancer with metastases to 13 axillary lymph nodes. Up until this point, Nancy had been regularly getting her screening mammogram. However, it was only at the time of her diagnosis that she learned that she has dense breast tissue. She strongly believed that her cancer would have been diagnosed at a much earlier stage had she been informed about her breast density. If she was informed that she has dense breasts and how that might limit the sensitivity of mammography, she might have undergone supplemental screening with ultrasound or MRI. She learned from her doctors that it was not standard practice either to discuss breast density with their patients or to recommend supplemental imaging. And so she was determined to inform and educate other women with dense breasts. Nancy Campello was the former Secretary of Education in her state of Connecticut, and so she began lobbying for state legislation. In 2009, the first breast density legislation and notification law was successfully passed in her home state of Connecticut. In addition, she also founded a nonprofit organization called Are You Dense Advocacy Incorporated. She also started a grassroots movement to advance legislation in other states and took her campaign to the national level. Her story and the issue of breast density received widespread national attention, and her organization was very effective in advocating this cause and getting the word out to the public and to legislatures. Sadly, in 2018, Nancy Campello died at the age of 66. The cause of her death was myelodysplastic syndrome, which was caused by the aggressive cancer treatments that she underwent in 2004. However, even after her death, she continues to leave a huge impact and legacy on how women are informed of their breast density. She has also greatly influenced the breast community's interest in breast density research and increased the availability of supplemental screening options to women with dense breasts. So next we'll talk about the current status of these breast density legislation. After Nancy spearheaded the first legislation, the movement and the campaign continued. So first in 2009, that was when the first legislation was passed in her home state of Connecticut. After that, other states continued to follow suit at a very fast pace. By 2012, California became the 5th state to pass breast density notification legislation. And along with Texas, New York, and Virginia. These are all shown in yellow. Then by 2019, there were 38 states that passed some form of mandatory breast density notification. An additional 3 states that are shown in green suggest or recommend notification. And as we will discuss later, by 2019, steps to implement density notification at the federal level were initiated. For now, but soon to change, an enactment is still at the state level. So these laws mandate that patients must be notified about breast density, usually as part of the mammogram results letter, but laws still vary widely in the terms of depth and breadth of the information that's provided. For states that have provisions, all mandate that patients need to be notified about breast density in general. Most, but not all, require that they let the patient know that they personally have dense breast tissue. Most, but not all, inform that dense breast tissue can increase breast cancer risk, and most inform that there's a possible need for additional testing with supplemental screening. In most states, the radiologist or the imaging facility bears the primary responsibility for communication to patients. Typically, the density notification is simply added to the standard MQSA lay letter. There have been some recent changes at the federal level. Since 2013, there have been repeated efforts to push for federal legislation, and these efforts have been bipartisan in both the House and in the Senate. Finally, after 6 years of repeated effort, in February 15th of 2019, federal legislation was signed into law as part of this funding bill. And most of the country and the press found out this through this tweet by the late Senator Feinstein. The law directed that the FDA needs to develop breast density reporting language that would be required in patient letters and health provider letters. This must include the patient's breast density, the effect of breast density on masking of breast cancer, a reminder that patients with dense breast tissue should talk to their providers if they have any questions or concerns. Unfortunately, there was no mandate for coverage of supplemental screening, and today only a handful of states have mandates to cover supplemental screening. So on March 9, 2023, FDA issued national requirements for density notification. By September 10th of this year, all facilities must comply. So again, by September of 2024 this year, the FDA will require all facilities to include one of 2 statements. There's one for patients with dense breast tissue and one for patients with non-breast tissue. So this is the required wording and lay summary for patients with dense breast tissue. Lets patient know breast tissue can either be dense or non-dense. Dense breast tissue makes it harder to find breast cancer on a mammogram and also raises the risk of developing breast cancer. Your breast tissue is dense. In some people with dense breast tissue, other imaging tests in addition to a mammogram may help find cancers, and encourages these patients to talk to their providers about their risk for breast cancer and whether or not supplemental screening is necessary. So next, we'll talk about definition and categorization of breast density. Based on the most recent edition of BI-RADS, the 5th edition, assigning breast density is based on a subjective visual assessment by the radiologist. The density that's assigned indicates the relative possibility that a lesion could be obscured by the surrounding fibroglandular tissue. And it's important to note that this is a change from how we used to define breast density in the 4th edition of BI-RADS. The method that used to be used was use quantitative percentages and quartiles, and this is no longer used. It's also important to note that our current qualitative assessment also differs from how most automated software models assign density, which is mostly quantitative. Breast density is currently assigned by the interpreting radiologist qualitatively into one of 4 categories. Note that the density categories are now labeled A, B, C, and D rather than 1, 2, 3, 4, which used to be used in the 4th edition of BI-RADS. And this change was made so that it would not be confused with the numbered BI-RADS assessment categories. If the 2 breasts are not of apparent equal density, then the denser breast should be used to categorize the breast density. So here are some imaging examples of the 4 categories. On the far left, we have category density A, fatty. Next, we have B, scattered, C, heterogeneous, and finally D, extremely dense. And again, the category assigned is based on the potential to obscure a cancer. So what is the distribution of patients by breast density? Well, population-based data from a representative sample of mammography practices in the US show that approximately 8% of women undergoing screening have almost entirely fatty tissue, category A. Approximately 7% are category D, and they have extremely dense breast tissue. More than 80% of women are either category B or category C. Also note that approximately 50% of screening population has dense breast tissue, which includes category C, heterogeneously dense, or category D, extremely dense. Therefore, breast density policies applies to approximately half of